Now, council in Ealing could become the first in England to enforce an exclusion zone around an abortion clinic. Campaigners say a buffer zone is needed to prevent anti-abortion protesters harassing women as they use the clinic. So a necessary protection for women using the service or an infringement of the right to protest. Joining me now from Central London is the chair of Labour Life, Ed Rennie, and also from Cardiff, we're hoping to speak to Dr. Pam Lowe, who's a senior lecturer in sociology, there she is, who's researched the effect the protests have had on abortion patients. To you, Ed Rennie, first of all, isn't anything that guarantees the safety of women and indeed staff using these abortion clinics to be welcomed?
Well, I don't see what relevance that has. Good Counsel Network are outside abortion clinics, and they're offering support for women who, in their heart of hearts, don't really want to have an abortion.
They say it's support, and the Ealing Council considers it to be a public order offence.
Well, Ealing Council are considering that. They have absolutely no evidence of that whatsoever. In fact, I was formerly a member of Ealing Council for the Labour Party, and I'm kind of astounded at my former colleagues pursuing this without any evidence of harassment whatsoever. What Good Counsel Network do is they offer a leaflet and they say to women going in, we're here to offer you support if you want to continue with your pregnancy. Now, if you're pro-choice, and a woman is vulnerable, she doesn't want to have an abortion, she feels she's pressurised into an abortion for economic circumstances, family members or a boyfriend or an abusive husband, and in truth she wants to continue with the pregnancy and have her child, but she feels she's not supported, then she welcomes that offer of support, and there are hundreds of women who have been offered that support and continue to receive that support as long as they wish to receive it.
Okay.
So that is something that's definitively pro-choice, and if you want to remove that choice to those women who don't have a broadband connection or aren't wealthy enough for all the support that everyone else can get, then that is not a pro-choice position.
Okay. Pam Lowe, it's not a pro-choice position. You've researched this. What impact do these people standing outside clinics have? As Ed says, they're simply holding out leaflets. They're offering support, they're offering advice.
Well, I think Ed has made specific reference to the Good Counsel Network, and of course it's important to say that the different groups involved in standing outside clinics vary enormously, and there's no control over who comes and who goes and what individuals do. So it might be the case that someone there for the Good Counsel Network doesn't necessarily be abusive. That doesn't mean to say that other groups are not abusive, and I think that's what's important to remember. There is no control over who stands outside the clinic, and this is a very specific form of street harassment. Women feel harassed because they don't know what the intentions are for the people outside the clinic, and there's been all sorts of reports. You know, women have been sprayed with holy water, women have been, called murderers. What happens outside the clinic varies enormously, and it's uncontrollable because it just depends on who turns up on the day. And women do feel harassed about that, and they don't necessarily need someone outside the clinic to give them a choice, because the idea that it's only people outside the clinic that offer women choices is based on a really strange idea about what happens inside abortion clinics. And if women go into an abortion clinic and say they're being coerced, the abortion clinic will not do the procedure and will offer them proper support from people who are qualified to give it.
Okay, Ed, let's just put those points to you. I mean, in terms of advice that you get if you are pregnant and unwanted, you can go to lots of different places. You can go to your GP, you can Google it. I know you said those without broadband connection, but you know, most people have access to a GP, and these two things immediately offer you advice and guidance on both things. I just Googled it myself. The first thing that brought me up was the NHS. It showed you links to how an abortion is carried out. It tells you can go to an NHS-run abortion clinic, you should speak to your partner, you can talk to your GP. There is no restriction on women getting this information themselves. Why is it that people outside these clinics feel they need to reinforce this information?
Well, what they've found is that a lot of women feel that that support is not available to continue with their pregnancy because they're poor, because they're coerced, because of economic circumstance. They feel they can't afford to have a child or have another child.
Are these people standing outside, if this woman can't afford to have a child, are these people standing outside these clinics going to support that child for the next 18 years?
Yes, that's exactly right. That's what I said in my first comments, is that Good Counsel Network make themselves available to support these women for as long as they need or want that support. That is the whole basis of the charity, and that is to help women who are facing difficult circumstances, who do not want to have an abortion, but want to have the choice to continue with their pregnancy, but have not found that support elsewhere. Now, the point is, yes, of course, Life Charity and many other works, including Good Counsel Network, have online support that people can go to, and they have multiple different methods. What Good Counsel Network have found is that, nevertheless, there are still women who are in unclear situations of immigration, or who are too poor to access the internet, as I said, and this is the only way they're receiving support for the choice to continue with their pregnancy, which is what they want, and they welcome receiving this leaflet, and they welcome receiving this offer of support.
I do know that internet is available for free at most libraries, so you don't have to have money to go on the internet. Pam Lowe, isn't Ed's point fair, though? You know, if minds are being changed, these organisations wouldn't exist if they weren't at least having some success. If lives are being changed at the gates of these abortion clinics, doesn't it show that there are some women out there who aren't considering all the options before they go through with it?
Well, I mean, it might be the case that there's a very small number of women who prefer to talk to random strangers outside the clinic than actually qualified, proper professionals. But I think that's a very small minority. And the fact of the matter is that the majority of women going to the clinic do not want to discuss their private business on the pavement. And this is a breach of healthcare privacy. You know, the different groups, and as I say, it's different groups. You don't know who's going to turn up. Some of them are, will film women going in inside out clinics. And it's a breach of healthcare privacy, and there is absolutely no need for them to be there. If women go into an abortion clinic and they are in two minds about having an abortion, they don't have it. We know from the data that the amount of women who do not proceed with an abortion does not vary, regardless of whether people are outside or not. So they're not actually having the effect that they think they're having, but they are causing a large amount of distress to women when in their attempts to actually stop abortion, which is what these organisations are for. They're explicitly against abortion, and that's what their central aim is.
I did appeal on Twitter to see if anybody had any thoughts about this. Nikki Hodgson, who's one of Sky contributors, she's also an author, she said, one of the most distressing things about the abortion I had was the protest. Nobody takes the decision lightly. To protest about somebody entering or leaving a clinic is abuse. Ed Rennie, why do you and these groups think that you have any right at all to intervene in a private medical matter?
The Good Counsel Network started getting involved in doing this work because they found that there were prayer groups, and these are not protests, these are prayer vigils outside the clinics, and that they found that other groups who were outside these clinics were having women who were not being reached through all the means that have been mentioned, including by myself. Now, the point is, Dr. Pam can speak to these women who have been helped by Good Counsel Network, and so the reason that anyone has the freedom,
there are women who go to clinics and don't go through with abortions. There are women who go there and they talk about it and they decide against it. Women walk out of these clinics every day. Just because they walk in doesn't mean they're going to have an abortion.
Well, exactly, and that's the point, is that Good Counsel Network do not assume that every woman who's going to the clinic is going for an abortion. They're considering an abortion, but many of them, hundreds at one clinic in particular, have found that they are under pressure to have an abortion for economic reasons, for pressures from family, in coercive situations as well, but also they may be refugees or illegal immigrants. And what they need is the offer of charitable support, solidarity, and support continuing through the pregnancy, through childbirth, and through that young child's life until they no longer need that support. This is the support that's offered by Good Counsel Network, and buffer zones will remove that offer of support. It will remove choice for those women who feel they're not supported in any way but to have an abortion. You can't be pro-choice if the only choice that's available is abortion. And Mary Stopes and the other abortion clinics, they don't offer support.
But it isn't the only choice. When you go to your GP or when you look online, it says, it's a big decision. You have to talk to friends. You have to seek impartial advice. This is what it involves. Make sure it's the right decision for you. That's impartial, is it not?
the abortion clinics only offer abortion. They do not offer support continuing the pregnancy, and they do not offer support throughout that young child's childhood after giving birth.
Okay,
that
Pam,
is
is
what
that
Good
true?
Counsel Network and other groups offer.
No.
Okay,
Abortion
Pam,
clinics don't offer
It's
anything
not.
else apart from abortion.
Pam, is that true?
It's not true. Well, the abortion clinic will make appropriate references for anyone who wants to continue like the pregnancy and need extra support. So they will refer women on, for example, if it's coercive situations. Can you let me finish, please? Right. So the abortion clinics will refer to professional organisations. They will refer, for example, if women are being coerced, to organisations like Women's Aid. That happens routinely. And actually, you know, the problem is that these organisations, and they vary enormously about how much pressure they put on women outside the clinic. There is no control. They call themselves pavement counsellors, but they're not qualified counsellors on the pavement at all. And, you know, and the majority of women experience this as harassment. And the idea that you know, that this is the only line between women having and not having abortion is just ridiculous. There are plenty other avenues, and women who go to abortion clinics and don't want to continue can be referred to professional organisations. They can be referred to social services. They can be referred to Women's Aid. They can be referred to an awful lot of places that are actually professionally qualified in supporting the women. So the idea that, you know, it's only, you know, the people outside the clinic offer support is just not true at all.
OK. They were going to have to leave it. It's Ealing Council who are deciding this issue tonight. I'm afraid we're out of time there. Ed, Rennie, Pam Lowe, thank you both very much. Ealing Council is going to have a meeting tonight to discuss whether or not they should implement one of these buffer zones in their borough.